Good afternoon, everyone. Welcome to our APO Symposium. We do this every year. Jubaida, are you here? Oh, yeah. Okay. So chairing this session will be myself, Seng Kyong Fang, the chair of the YO, Marcus Ang, secretary, and also Jubaida Aquino. She's here in front. Okay, before we start, I would like to thank all the YO committee for working hard throughout the year. We now have actually 4 subcommittees, and we have been having a lot of help from all the members of the YO standing committee as well. And I think Marcus will mention later on, we are also asked to champion sustainability for our YO committee. So we are actually now also have a survey going out. Maybe later I can ask Wendy to share about the sustainability survey, and we need response from all the country. Over to you, Marcus.
Okay, thanks everybody. So welcome. I think that just want to give a brief update, and later on hopefully we have a quick presentation. I mean, all of you are here because we know you represent all the YOs, and you guys are the leaders and the future of ophthalmology in Asia Pac. Briefly, I think you guys know this. We started this in 2016, 2017. And since then, in 2016, 2017, there were probably 2, 3 formal, informal YO societies. But now I think in the last 10 years or so, it's now expanded to over 20 plus YO societies. So I think we're very proud of that. We can do more. We can do more. What we are hoping to do over the next few years is not just to be present or be formed, but to form the strong networks that we already have. And of course, continue to support the young ophthalmologists through not just wet labs, education training, and the stuff that we do virtually, but also through mentorship. So I think you see and hear a lot more about the mentorship coming up over the next 1 or 2 years. So I'll leave it as that because I think we do have a few presentations to get through. And so I think the first part, what we'll try and do first, is I'm going to give, just for those of you who are here for the first time, every year at the YO Symposium, we invite top 5 or 6 YOs who have submitted abstracts for presentation. So this is on top of whatever poster or free paper that you've submitted. And from here, we will select the best presentation for the YO Symposium. The difference is you'll be judged based on not content, but rather delivery, because we all come from different regions in Asia Pac. Some of us have access and capability to do research based on your mentors or projects that you've done, but some of us are not able to do such high level scientific research, so we want to level the playing field. So the focus of the YO presentation really is about delivery. It's about how you interact with the audience and how you answer the Q&A. So I just wanted to highlight that. So without further ado, shall we do the YO presentation? Yeah. So I'd like to invite the first, and of course we had 5 or 6, but again, as in every symposium here, visa issues. So we now have 3. So the pressure is on now. I think we have two prizes, right? We have 3 prizes. So all of you are winners. This feels like my son's competition, in school, and everybody goes home with a prize. But still, I want you to do your best, man. And it's cash, so please. How much cash is it? 500. I also won. We're so generous. My goodness. 6 minutes earns you $500. So I think it's better than your residency paying. All right. So first up, we have Shirin Sonvane, who will be talking about ICLs for short eyes and not so long eyes. Yes, please. Oh, sorry. One more rule. If you exceed your time, you'll be penalized. Yeah.
Good afternoon, chairpersons. Good afternoon, everyone. I'm Dr. Shireen. My topic is phakic IOL for low to moderate myopia, a retrospective analysis of 361 cases. There's no conflict of interest. The surgical indication for myopic ICL has generally thought to be indicated for high myopia, but in few cases of mild to moderate myopia, when corneal parameters are not up to the mark and dry eye is a concern, ICL remains as the best modality. Ours is the first study in India reporting ICL in low to moderate myopia. The aim of our study was to analyze safety, efficacy, predictability, and stability of ICL, EVO Star Surgical, for mild to moderate myopia. We retrospectively assessed 361 eyes of low to moderate myopes undergoing ICL with a 0.36 mm central hole at a single center for 3 years duration. We selected cases who had spherical equivalent less than or equal to 6 diopters, who were not suitable for laser, or those who chose ICL as a primary option. Thorough refractive workup was done for these patients, including wide field photography, gonioscopy. Barrage laser was done whenever indicated. Anterior chamber depth more than 2.8 mm and normal specular were included. Age less than 21 years and more than 50 years were excluded. Pigment dispersion and angle less than 3, grade 3 on gonioscopy, specular less than 2000 were excluded. All routine steps of ICL were followed. Calculations were done by manufacturer's online calculation and ordering system. Marking was done on slit lamp for all toric implants. Vault was performed after 2 hours of surgery, and other surgery was planned after 24 hours. We got mean 29 years in the age. Mean spherical equivalent was minus 4.3. Mean ACD was 3.26. White to white was 11.47, which was confirmed digitally on Cirrus Pentacam, and IL master and collaborated value was taken for size calculation. Central corneal thickness mean was 499 micron. So normal corneal thickness was taken as more than 520, less than 520 was taken as thin. To analyze corneal thickness and shape further, we categorized cornea into 4 groups. Group 1 had thin and borderline category. All suspicious pentacams were categorized into group 1. 6 patients had undergone LASIK in past and regressed over the years and included under group 1. So ICL was used as an enhancement tool in these patients. Group 2 had normal thickness and normal shape. These cases had primarily opted for ICL in spite of having options. These were 25. Third group included 10 cases with keratoconus, out of which 6 had undergone cross-linking for stability and other 4 were confirmed to have stability over time, and then they have undergone ICL procedure once it was established to be stable. Post-operatively, most of our patients had walled between 500 to 800 micron. Here's a graph demonstrating visual acuity trends in Snellen decimal, pre-op best corrected versus post-op uncorrected. Mean post-op uncorrected visual acuity was more than mean of best corrected pre-op, indicating efficacy of the study. 12.5%, that is 45 eyes, had 1 line gain in the vision. 1 case had gain in 3 lines and no lines were lost. 100% patients had spherical equivalent within 1 diopters in minimum 1 year follow-up, and it remained stable from 1 month to 12 month post-op. Safety and efficacy indices were excellent, 1.32 and 1.33 respectively. No intraoperative complications were noted. 3 eyes of 2 patients had steroid response. They were, after tapering steroids, they stabilized. 3 patients had ICL exchange. Post-exchange, they had normal vaults. So far, there have been 5 series for low to moderate myopia. Pinto et al. From Portugal, Packer et al. From USA, Alonso from Spain, Kamiya et al. From Japan ICL study, and our study. We have highest safety and efficacy index. Kamiya et al., a study from Japan, had reported 172 eyes from less than 3 diopters from 7 nationwide centers. Ours is a single center study with 56 eyes less than -3 diopters. Kamiya et al. Compared first time high versus low myopes and reported 57 eyes less than 6 diopters. We have 361 eyes less than or equal to 6 diopters. So all these studies established that ICL was a viable surgical option for low to moderate myopia. All were multi-center studies. It is noteworthy that ours is a single center study. All other studies included multiple surgeons and hence multiple techniques were involved. We had a single surgeon, uniform techniques and similar surgical conditions. We are the first group from India to report this large number of low to moderate myopes undergoing ICL. We are looking into our 10-year follow-ups and analyzing. Longer studies are required, hence I suggest a report that larger study ICL in low to moderate myopes with excellent visual and safety index and efficacy index. Thank you, my mentor, Dr. Vardhaman Kankriya. Thank you, AIOS2025-GP4-APAO for giving this wonderful opportunity. Thank you.
Thank you, Shirin.
Yes, sir. Any questions?
So thanks very much for the great presentation. So in your study, even though it's a small sample size,
Yes.
right? If you were to design, if I were to give you unlimited resource or abundant resource, what would you ideally do next to answer your question? Because you said there's some limitations to your study.
Yes.
So what kind of study would you design and conduct next step?
So it would be a longer duration study, sir. Secondly, it would be a prospective analysis instead of a retrospective analysis. And it could be also nationwide to include all regional and other races also.
Okay, that's great. I think you're right. I think obviously a prospective study would be stronger. Definitely a larger inclusion would strengthen your study. I think for most ICL outcomes, actually you don't really need long-term outcomes unless you're looking at safety issues,
Yes.
vault or even endothelial cell loss.
Yes.
But most refractive outcomes for ICL actually remain rather stable, except in a subgroup of high myopes. Sometimes they
Yes, sir.
regress. So, great. Thank you very much.
Thank you, sir. Thank you, everyone.
I'd like to call the next speaker, Wan Nawan from Malaysia. She'll be talking on the impact of mobile cataract program on the improvement of effective cataract surgical coverage. Yeah.
I just want to remind the speakers that if you exceed the time, it could cost you $100 USD. So please stick to the time. And I mean, obviously I'm trying to keep this lighthearted, but it's something that as when you become more senior and you join the formal presentations in the other sessions, sticking to time is something that a lot of chairs value. So I think it's a good hygiene and habit to develop now. If you sorry, I'm ranting a bit, but as you become more and more established, you're going to be invited speakers. And so we wanted to create this safe space for you guys to have this. But the things that we're trying to teach is very important, and if you need to be at home, we have to reset the timer for later. But when at home you're preparing your presentations, time yourself, make sure you're in time, right? And you can deliver a good presentation. Can we reset the time to the beginning again? Thanks.
Yeah. I think they said it for 5 minutes.
5 minutes. 5 minutes, yeah. Okay.
Mr. Chairperson, good afternoon. I'm Dr. Wan Razia from Malaysia. It's truly an honor to be here today to present to all of you the impact of mobile cataract program on the improvement of effective cataract surgical coverage insights from National Eye Service in Malaysia. I have no conflict of interest with Claire. For introduction, effective cataract surgical coverage, or ECSC, is one of the important universal health coverage indicators recommended by World Health Organization. It is calculated from population survey. It measured the access and quality of eye care service in the community. While cataract surgical coverage measured the proportion of people in the community who had cataract surgery, the ECSC is slightly different as it measured the proportion of people who had cataract surgery and had achieved good outcome. This is a formula to calculate the CSC and ECSC. In Malaysia, we conducted 2 population eye survey, branded as National Eye Survey 2 in 2014 and National Eye Survey 3 in 2023. In 2014, we conducted simultaneous survey in 6 zones of Malaysia: Northern, Eastern, Central, Southern, Sabah and Sarawak, using the WHO recommended rapid assessment of avoidable blindness RAP methodology in subjects aged 50 years and above in the selected enumeration blocks. So one of the next two findings is the effective cataract surgical coverage. We can see here that there is a discrepancy in the ECSC at the 4 cataract surgical threshold across the 6 zone. If you look at the red dot, you can see that Sabah had the lowest ECSC at 612 threshold at 15.9%, followed by Sarawak at 18.8%, but other zones had higher ECSC, with Central being highest at 53.2%. So with these results, we realized that there was inequality of eye care service in our country. So we pledged to our minister to expand our service and make the changes to improve the quality and make sure it is accessible to everyone, including the underprivileged and those in the rural area. So we came up with this Cataract Clinic Ministry of Health Malaysia, KKKM, which consists of Satellite, Transit, Mobile and Carnival. The mobile cataract program was piloted in Sarawak and Eastern region, where the ownership and the network between hospitals, NGOs and community leaders have been established with the aim to reach out to the remote population. We use our mobile unit to transport the equipment for ocular examination and cataract surgery, such as slit lamp, keratometer, phaco machines, to the district hospital where the ophthalmology service were not available. So during the visits, we screen the patients for cataract and perform biometry and preoperative assessment. The patient will undergo cataract surgery during the same weekend by our experienced surgeons. The cost of the surgery is totally free of charge, and the lens, the intraocular lens, was sponsored by our local NGOs. So after 9 years, we are operating for 9 years, we did another RAP survey in 2023, the National Eye Survey 3, at 2 regions with the mobile unit, which is the Eastern and Sarawak. So we can see that we compare the effective cataract surgical coverage. We notice that there is a significant improvement for Eastern from 20.4% at 612 threshold, improved to 39.2% in 2023, and for Sarawak from 18.8% to 37.4% in 2023. So for conclusion, improvement of the ECSC is likely attributed to the mobile cataract service in both regions. However, a more coordinated approach is needed to further strengthen and expand the program to enable our country to achieve the 30% point increase in the ECSC by 2030 as targeted by WHO. Our cataract program also has been selected by WHO Western Pacific region as a case study in 2021, and report has been published in 2023. With the commitment to continuously improve our service to our people, we strive to bring Malaysia to the forefront of global eye care. Thank you.
That's a good job. You can breathe. You can breathe now.
Thank you.
No, I think that's excellent work. I was going to ask you, so when you go back to your second last slide, you're saying that what's next? What's the coordinated effort that you need? What do you think is the more sustainable? I mean, what you've done so far is fantastic, but what is the more sustainable solution you think that you would propose?
I would think of public-private partnership, so that we can work with like our private ophthalmologists, so that we can achieve better service, especially to those people who are underprivileged.
Okay, what about within Sarawak? So you're now using mobile units and you're going to Sarawak where there are not enough ophthalmologists. How would you, in the longer term, sustain that program? Because going in repeatedly may not be so...
Actually, currently, we are the ophthalmologists who perform cataract surgery during the KKKM in Sarawak, not only from local ophthalmologists, but we bring ophthalmologists from other states as well, even from private.
So I think what I'm trying to allude to is that a lot of programs, outreach programs around the world, not just in Malaysia and Sarawak, I think an important aspect of the program is capacity building. So training the young ophthalmologists or even the incumbent ophthalmologists and to get them to do the surgery eventually, to take over the load. But also that has to be ministry backed, because remuneration and financial support for these programs have to come from the ministry as well. But thank you very much. Do you have any questions?
Yeah, on the other aspect of patient awareness and education, is there anything that the ministry is doing?
Actually, currently at the moment, we start our campaign on awareness on blindness and other ocular disease by social media. We collaborate with our Ministry of Health to publish posters and flyers through Facebook, Instagram, and TikTok as well.
Any question?
Great. Oh, yeah.
Zubeda, you
Yeah,
have any
sure.
question?
Coming from an archipelagic country as well, just like yours, we have difficulty. There are patients from the far-flung areas reaching the cities as well to get their cataract surgeries. So we're worried about the safety of yung follow-up of the cataract surgeries. How do you conduct the follow-ups of these patients if it's a mobile?
Actually, for our program, our team, the medical officer and optometrist, will visit the district hospital at 1 week and 1 month post-op. We will visit them. And all the data, the pre-operative, operative, and the post-operative data will be entered in our national eye database, our online cataract registry.
That's great. Thank you.
Thanks very much. Thank you. Great job. Okay, last but not least, the third speaker is Dr. Putera. Oh no, yes, yes. Yes. Because sorry, my program is not printed. It's not aligned. So are you going to talk about uveitis? Or?
Yeah.
Yes. Okay. Good.
Thank you for the opportunity. So my name is Iwan, and I'm from Indonesia and currently doing PhD research. I would like to talk about these two promising serum biomarkers candidates in uveitis, B cells activating factor and CXCL9, especially for ocular TB and sarcoidosis. So I don't have conflict of interest. Talking about TB uveitis, you may be familiar with these clinical pictures. In majority of cases, real world, we diagnose mostly by immunological tests. In some patients, you may find active disease, but finding an TB in the eye is possible, but has low diagnostic utility. So I present you again these TB pictures, choroidal granuloma and occlusive retinal vasculitis. What if I present you this one? Kind of similar, but in fact this is sarcoidosis. And if you look at the SUN classification criteria for these two entities, a lot of similarities exist in the uveitic syndrome. And you can look at the exclusion criteria, one need to exclude another disease. In other words, you need to do investigation and you can go wild with CT scan and something else. So this is a $1 million question in uveitis. Can we simplify this approach? So we start with TB and sarcoidosis. We do serum proteomics analysis, analyze bioinformatically. What we have just recently described is that we could figure out a lot of similarities in terms of immunological pathways. We could see that some markers elevated in both diseases like CXCL9. We could spot on marker for sarcoid, which is serum buff, but we couldn't identify marker for TB. But then we carry this forward. Now look at this riddle. We get another group, which is other uveitis now, and it can be mix of other different entities. If we can differentiate TB and sarcoid based on serum buff, but we couldn't spot on marker for TB, what if we use marker expressed in both diseases, but should be not expressed in other uveitis? And by this way, we can separate these three groups. So we start with in silico approach using bioinformatic analysis. We could at least retrieve PKH and Behçet's disease to start compare with. And we see that buff pathway eventually observed only in sarcoid, CXCL9 only sarcoid and TB, but not the other two. So it's kind of promising to combine these two biomarkers, meaning that double positive refer to sarcoid, one only CXCL9 TB, double negative to other uveitis. Then we start with patient samples. So we get biobank samples. We retrieve randomly 10 ocular sarcoidosis to start with, PA proven, so no question diagnosis. we compare with other uveitis entities. Keep in mind that BAF is comparable in healthy Indonesian and Dutch, so we can compare both in the similar manner. In a TB, we have two subsets. The first with confirmed disease, either PCR or active systemic disease, and the other only supported by IGRA positive. But we will first look at this established diagnostic first, and then what if we apply to this IGRA positive uveitis. So this is the Filin plot, if you're not familiar with. So it's, you can see the middle line is the median. Indeed, BAF only expressed in sarcoid, low in TB, low in other uveitis, meaning that it supports our prior in silico approach, which is good, and this time with very good specificity, almost 90%. And how about CXCL9? And we see that it's highly elevated in sarcoid, comparable to TB, and indeed it's significantly lower to other uveitis. Also support our prior hypothesis, and this time with very good sensitivity, almost 90%. Now come the interesting part. What if we look at the TB spectrum, including those with IGRA positive only? So we try to analyze retrospectively how the treatment works, because these markers measured at the baseline. And indeed, those with high CXCL9 will get resolved better if we could prescribe full ATT compared to those not. If we narrow down to IGRA positive only, it's not statistically significant, but if you can see that the similar trend exists, so we think that it's just a matter of lower sample size. So in conclusion, uveitis is not easy, but we can make it easier. And by this combining two biomarkers, we see that this is promising. And there are two plans in hand. First, to do extended validation, and at the same time, we are now in collaboration with Delft University to make point-of-care tests. So you can imagine with the glucose strip, with just serum samples, not touching the eye, you can identify whether it's TB or sarcoid or something else, so you can prioritize your investigation in uveitis. Thank you very much.
That's a great talk. So I know I'm a cornea and refractive surgeon, but actually when I was younger, I had a lot of interest in TB uveitis. So
yeah, I read your paper a lot.
okay, so you know what I'm going to ask, right? So I think that, you know, the see, when you're doing these biomarkers, the phenotype is very important. And the problem with TB uveitis, as you've alluded to, is the diagnosis. So your 10 cases are confirmed ocular TB, whereas the presumed TB group is controversial, whether it's immune-mediated or actual ocular TB. So my question to you was, did you also correlate your serum with ocular samples? Because the activity of the TB uveitis is important at the timing of which you measure. So for example, if you have a chronic granulomatous kind of uveitis and it's been partially treated, you know, when we did our ocular biomarker sampling, we found that the biomarkers or the proteomics was the biomarkers quite low in terms of the sensitivity and specificity. So can you comment on this? Yeah.
Thank you. This is a very interesting part. So our group start first with the systemic biomarkers. Of course, we would like to get into the ocular samples. If you see the CXCL9 actually also described by you in your paper in the intraocular samples, CXCL9 expressed in presumed ocular TB. So we think, yeah, it's just the matter how we start with. And eventually, following some classification with TB, there are two groups. One, Dr. Basu in India, and yeah, at least our group doing systemic, so Dr. Basu doing ocular fluid or ocular samples. And it seems like all of these congruent in the similar direction. So yeah, of course, in our next plan is to get into the eye, but with the works that somebody else also doing, it's like building up toward the end. But why we prioritize the systemic, because it's easier. I mean, yeah, like doing glucose tests, it's not really need to go to the specialized room or OR to get the samples, because we think that it must be possible with this systemic kind of involvement in the uveitis. Yeah.
Great work, thanks. Any other questions? Oops.
One of the questions about new technology or new tests would be cost. How would it be affordable for countries wherein it's developing countries, low income or low resource countries?
Yeah, thank you very much. So this is I think very relevant question. And yeah, we try, so that's why the reason we start collaborating also with Delft University, because we would like to make it available as cheap as possible. In Indonesia, we have more islands, and of course, it's not possible to get it into the tertiary hospital to get CT scan and the other stuff, biopsy and so on. So the idea is to make it like real device and then spread into areas that can, yeah, with the cost lowering down without, yeah, if you order CT scan, you do sputum samples and biopsy, it will be cost a lot, but with this device, we hope it really significantly reduce the cost and widely available. And you don't need to refer patients from one island to another island just to confirm this is not the disease. So that's the idea, to prioritize the referrals and, yeah, to start looking somewhere else, something else, if it's not TB or sarcoid. Of course, we also keep in mind with the price.
Okay, thank you very much.
Thank
you. That was great. So while we're collating the results, I'm just going to invite Chai, do you have the slides? To share a survey that we did. I think thanks to many of you who actually answered the survey. We wanted to share this because I think it's important. We've been doing, as I said, we've grown in terms of YO societies from Asia Pacific, but then what we want to know is what impact have we actually made, and what impact are you guys hoping to have in your societies? And then after that, I think it's a nice segue to the first panel discussion, which we'll invite some of the panelists to come up and speak. Can I get some help with the chairs? Can we have put 4 chairs in the front? Yeah, thanks. So over to you.
Okay, so hi, good afternoon, everyone. I'm Chaitan Lapka from the Philippines. So we conducted this survey entitled The Impact of Young Ophthalmology Programs in Asia. The questions were curated by Marcus, and then I helped conduct the survey. The mission of APAO-YO is to support the education and training of YOs, to develop YO leadership empowered through networks, and to promote continued learning and development through mentorship. And then we conducted this survey primarily to understand the impact of existing programs and explore unmet needs for YOs in our region. And then, of course, to plan for the future of YO programs. So this survey had 3 sections. So first is the demographics, second would be the perception over the programs, and finally will be the benefits. Okay, so for the first part, we had the demographics. There were 387 respondents throughout 21 countries in Asia. Most respondents were from the Philippines because they were scared of me. So that's why. Next were from India because they were egged by Divakant and Prasanna. And then the other ones. I think the proportion of the respondents were actually were parallel to the strength or the number of the YO societies involved. And then, so for the demographics, majority were young consultants. Majority of those who answered the survey were in their 31 to 40 years old, 6 to 10 years of practice, and they were relatively young consultants, probably because they had more time. They had more time to, sit down and answer the survey. And the number of years in the local YO, of course, APA-YO is relatively young, and this explains it. Less than 5 years, there are more respondents who said that they were involved for less than 5 years. And then, of course, there will always be more regular members over the committee members. Years active in local YO, most were less than 5 years. And of course, there were more respondents who were not involved in the APAO-YO. This is understandable because, of course, more people will be more involved in their local areas. So next would be the perception of YO programs. We conducted this in such a way that there will be a range of answers from the subject to be least significant up to most significant. We're happy to say that most were towards the most significant. So most of the answers were skewed towards most significant. So we asked about the perception of YO programs, whether the support and facilitation of clinical programs were how significant it was to the local YO. So in the local settings and in the APAO community, most answers mirrored that in the local and in the APAO community. So we asked about support and facilitation of clinical programs, development of YO networks, leadership, development, support of non-clinical professional development in eye care and beyond, provide avenues and opportunities for mentorship, opened opportunities for fellowship or future job opportunities. Whether they created avenues for research and collaboration, and then whether they drive advocacy programs. For the current benefits of YO programs, the answers skewed towards the middle already. So from being most significant, most answered became 4. So we asked about clinical training and education programs, the benefits of community training and education programs, leadership, again, professional development in career, mentorship, career guidance, and then introduced to fellowship and job opportunities, and research collaboration or multi-center trial, achieve funding, etc. So answers became more skewed towards the middle as perceived by the YOs for the current benefits. So we also had an open-ended question on whether the respondents could suggest other potential benefits of YO programs. So we created a word cloud. Majority said none. So we're happy to note that, people were more or less contented with the current YO programs that we have. So for the analysis, the strengths of the programs in APAO would be education and mentorship. These opportunities are rated highly, suggesting that these are valued and impactful. Advocacy programs and fellowship opportunities are also well received. So the potential areas of improvement, community training and education, and leadership development skills were relatively lower rated. So there is a big disparity in responses. The standard deviations were a bit high, so 1.2 to 1.3, stating that there is inconsistent impact across areas. So in different countries, there were inconsistent reception. So that for the future direction, we plan to have, we want to strengthen the engagement both in the local and international settings. We want to have more international collaborations, more LDPs, targeted leadership courses, professional development focus. So we want to have career coaching and soft skills training, mentorship, job opportunities, and research collaboration. Of course, broadened awareness and participation. We'd like to encourage social media participation. So if possible, funding for incentivization and recognition of involvement. So thank you for your kind attention.
Thank you so much, Chai, for doing this. Real credit to her efforts. And I think this survey is important to us because we want to know what you guys want. And so I think, not everybody responded. We'll try and send another round maybe next year again, because I think perception will change. But I think we will focus more on like mentorship, network building, and I hope that you guys participate in next year's APAO or APAO YO sessions. Great. So I'd like to invite the first panel to come up. I think you know who you are, so I won't give you the floor to basically introduce yourselves. Please come up. And as they're coming up, I wanted to give some airtime to Wendy. So, doing surveys are extremely difficult, and one of the pillars of YO really is the future, which is on sustainability. So Wendy, do you want to share a little bit about the survey you're trying to send out? And if you guys receive such surveys, please try and respond. I mean, Chai and I worked really hard to get this survey going, but, to give you some chair time, but you only have 2 minutes. No, I'm kidding.
Hi everyone, I'm Wendy. I'm the president of Malaysia Young Ophthalmologists. Thank you for this time to promote my survey. This survey is actually done in conjunction with APAO, who supported the survey. This is the first ever Asia-Pacific centric survey in sustainability. I don't know if any one of you here are aware that healthcare contributes the 5th largest contributor of greenhouse gas emission globally. So with the increasing of Asian population, it might not affect us now, currently, but if any of you who have families, you have children, and they may have children, it will definitely affect them in the future. Earth is the only home that we have, and we are all sharing this. So I think it's important that we all play a role. The first is to understand whether or not what are we doing? Are we doing enough? Are we even concerned? In 2020 and 2023, North America and European ESCRS has conveyed a sustainability survey. It shows that high majority of them are concerned about global warming. What about those in Asia Pacific? We do not know, and this survey hopefully could tell us what are we thinking about sustainability as our work as ophthalmic surgeon. So I hope that if you were to receive the email link, please do answer. Feel free to distribute it to your friends and to your senior ophthalmologists, anyone who is doing cataract surgery, because we want to know, and we want to know what you are doing. What I'm doing in Malaysia may be different from what you are doing in Indonesia, in India, in Japan, in Korea. So please let us know. Please distribute the survey, and we hope that, I think this is going to be the first and the only sustainability survey moving on forward. So to the young leaders here, I thank you in advance.
Thanks, Mandy. In other words, what she's saying is don't junk her email, that's all. That's the take-home message. Okay, great. So let's go on to the first panel discussion. We're very lucky to have YOs travel from all around the world. So I think, maybe for the first panel discussion, maybe you can introduce yourself briefly, what stage of your career which country you're from, what stage of career you're from, and then also briefly share about what's the YO status in your country. Yeah. Ladies first.
Hi, I'm Pasant Abdurrahman. I'm a young ophthalmologist from Egypt. I'm on the MIACO board, the YO board, which is the Middle East and Africa Council of Ophthalmology. We've also started our first online YO club in Egypt last year in the summer. I'm also a global ophthalmologist doing some work in different parts of Africa. That's about it.
Hello all. I'm Lala Mamadova from Azerbaijan. I'm currently the board member, chairperson in Azerbaijan YO, which founded 2 years ago. And I'm also the social media subcommittee member and also Azerbaijan representative at the European Society of Ophthalmology. And also 3 months ago, I've announced Turkish Republic's Ophthalmology Society YO president. Yeah, that's all. I'm so happy to be here.
Great, welcome.
Hi everyone, I'm Shruti Arapalli. I practice vitreoretinal surgery and uveitis at Emory University in Atlanta. I'm really lucky. Our YO society is very active. It's led by Evan Silverstein. We have monthly or bi-monthly meetings where we put out publications, articles, resident and graduated oriented topics that are elicited from our group. So it's been a wonderful experience.
Thank you. Thanks for coming all the way.
Afternoon, everyone. I'm Johan Snyman. I'm from South Africa. I present the OSA South African Community of Ophthalmologists, the Young Ophthalmologists. I'm the president there, very old president. It takes that long to specialize in South Africa. No, it's we've got a small group in South Africa. We've got about 230 members in the YO community, very active, supporting each other. We've been established about 6 years ago. We're having a weekend every year specifically for the YOs, where we just let our hair down and do some studying and networking. And we're great to be part of the whole group, the bigger group of ophthalmology.
Fantastic, fantastic. So I have some, thanks for coming from all different parts of the world. And you've spent a few days with us, and hopefully you've had a chance to interact with the YOs from APAO. Maybe we can hear from you. What are the programs or the priorities for your regional local YOs societies? That's number one, to see if it's similar to the APAO. And number two, what do you see from your interactions so far with our APAO YOs that are similar to your own societies? Yeah. So Free and easy.
Well, first, in my opinion, you're doing a great job at APAO. Just like you said at the beginning, in Egypt, we're also focusing on the mentorship part. We're networking with the adult ophthalmological society, like the Egyptian Ophthalmological Society, which is very supportive. Also, I'm a part of the International Meetings Committee of AAO, the American Academy of Ophthalmology, and I represent ophthalmic surgery, the resident and the associate society of the American College of Surgeons. And in Egypt, we're very focused on acquiring research grants for our YOs and hands-on surgical training. The difficulties that you face is probably the fund, and I'm sure you can relate to that. So basically getting those scholarships, getting those research grants, facilitating multi-center studies. We have so many great universities in Egypt. So as YOs, you have the time to, do the research, and how to have research like an essential part of your residency and early fellowship career. These are the main, our main priorities for this time.
Fantastic.
Yes.
Lala?
Our priorities in Azerbaijan is mostly to the training, because we have the problems with the surgical training, especially with the PACO training for the young ophthalmologists, and now we mostly prioritize to the training, hands-on training especially. And also we try to support our YOs to work with team in the committee, to work with team and society. We're organizing our own conferences, second time we did in February. And from the other side, we're also networking. We're doing it very strong, because we should introduce our society. This is motivating our YOs also, and we're trying to show what we are, who we are, because we're so little country in the world, like a tiny dot on the map. And most of the international ophthalmologists, when you're introducing your society, they even don't know where the Azerbaijan is situating. And the prioritizes, the last one is also the networking. Now, and I'm also representing and the SOE and the Turkish Republic Ophthalmology Society, which included the 7 countries. We, especially in Turkish Republic Ophthalmology Society, we also prioritize networking and training.
Fantastic. Thank you so much. And American Academy?
Yeah, I would say that from what I've seen, there are a lot of similarities between the American organization and APAO, namely networking and encouraging YO involvement in the societies. I would say for us, some of our biggest influences are targeting early career subspecialists for clinical issues they may face in their first several years. So every year we put out a publication on difficult surgeries or clinical conditions you shouldn't miss. And then one of the other things that we are invested in is bringing in early involvement into underrepresented subspecialties. So influencing residents or showing them things like uveitis, because we have very low involvement in uveitis in the US and it continues to decline, or pediatric ophthalmology. So setting up programs to show them what those clinics can look like, what you're exposed to, and how you can practice successfully and happily.
Thank you.
So yeah, this is a topic we can discuss this for hours, but the similarities are amazing between what we have in Africa and also here. I'm very excited about Africa and what we do there, but I'm also very concerned. We have, in South Africa, we only have 400 registered ophthalmologists for 65 million people. And so we are very understaffed, and that's our biggest worry. And the residency programs are getting smaller and smaller. And we need more registrars, residents, and posts to train doctors. So we are falling behind in that. So that's where we really need support. We're trying to support ourselves. We've got a big group doing our CPD sessions, our online sessions monthly. and working very hard on training. We have the opportunity. There's thousands of people that need surgery. I mean, we can walk in any theater and every resident can do 10 cataracts a day very easily. But we don't have, we've got too many patients and too few doctors, ophthalmologists specifically. So that's our concern, and that's what we try to improve. That's where we really want to get the private sector to support us in the government sector to really be able to train more ophthalmologists.
Is the barrier the training programs or the funding of the training programs, or is the barrier that are there enough doctors or young doctors who are interested to join the ophthalmology program?
Yes, there's too many doctors. So we've got doctors working in hospitals for free to be able to get into a program. I did it myself for 5 months to actually get into a program, and then you're also not guaranteed of a program. So the funding for the programs is the problem, not the people. There's doctors, hundreds. I can give you hundreds of names, but the funding.
I think across Africa and maybe Middle East as well, I think it's similar to, and SOE, similar to Asia Pac, where you see such a heterogeneous and discrepancy in resource allocation. Whereas in the American Academy, of course, you have more homogeneous, your consensus on training and standards and guidelines. And I think this is something which supranational societies like APAO, YO, and even the African and Middle Eastern YO can come together. SOE can come together and say, look, in our country or in our region, these are the minimum standards. This is what we recommend. You should have X number of residents in your. That's a powerful advocacy piece because the governments need to hear it, and I think this will really drive the impact of our YO programs. Jupes, do you have any questions?
Yeah, so I think you've done a really great job on your local YO societies. But for those who are starting their YO local societies, may we hear if you had any challenges as you were building your YO societies, and how were you able to overcome them so that you can give advice to those who are just beginning and starting their YO societies in their countries?
When we started our online club, we didn't face many challenges. We wanted to stay away from those, legal procedures and things like that. So this is why we chose the online format. We also did something that's very smart. We decided that if we get grants and scholarships, we get the funds through the already existing adult societies, so that we save ourselves the effort of the time and papers and things like that, bank accounts, and then those societies can also mentor the YOs. So we didn't want to reinvent the wheel, so we did it in a better way. By having it in an online format. So we avoided the traditional challenges.
In Azerbaijan, we started our society from 2023, but before that, we had our own conference, which it was 16th this year. That it means that before the society, we always had the young ophthalmologist team with. We organized our conferences by the support of the parent society, and then they decided to support us to make our own society when they thought that we're ready for that. Of course, it was now it's still so hard to make it to make everyone to work together, and some of them just demotivated about that. But the main thing, I think, that to encourage them, motivate, and make them to work with team, not one person. This needs the teamwork, and also the networking. I always think the networking is one of the most important things to improve.
So yeah, we as also YO did piggyback on our big OSA, as we say, we call them. So we just basically copy what they did and have the same structure, because we are the young guys that's going to go on towards the bigger groups anyways. So that's the progression that we try to do. And our biggest problem is usually with funding, especially in conferences. But we got around that by involving the trade and industry. And there's a tip for your young guys. It's easier to teach a new dog tricks than an older dog. So the trade understands that very well. So they would want to expose all the young ophthalmologists to all the new equipment and the new procedures and the new lenses. But if you've got an old surgeon that's used to his lens, he's not going to change it quickly. But the young guys will maybe consider new things. So that's where the trade and industry is very keen to support us and actually help us with our conference. So they're really keen to show us everything they have, and then we can make our own decisions and get us involved in their business. Yeah.
Wow, that's great that you were all able to make your societies flourish in your countries. And I'd just like to ask, what do you think is the role of the supranational YO societies, like for the APAO or the, I think, Pan American YO or the, yes. So what do you think are the role of the supranational YO societies?
I think the role of MIACO, the Middle East and Africa Council of Ophthalmology, is definitely mentorship. We were very supported by MIACO. And also, I'm very lucky that this year the two worlds meet together. Egypt is the Egyptian Ophthalmological Society is the host for the MIACO, this year's MIACO Virgin. We're getting spaces during the conference to have our own courses. We're being supported by mentors. They help us network. And MIACO has different divisions, which is like APAO. We have the VRS division, the cataract or refractive surgery. We have also a woman division. So these specialized divisions are very supportive. So when we need information in any subspecialty, we always find the right people to speak to.
Sorry to interrupt, but is there an African
Yes, there's the African Ophthalmological Council, the AOC, and there's the MIACO, which is the Middle East and Africa Council of Ophthalmology. Yeah.
Is it Central Asian? Not really. Central Asian for Azerbaijan, and is there a Central Asian one or not? Not so much. It's under SOE, is it?
For Azerbaijan?
Yeah. No, is there a Central Asian? Central Asia?
We have not.
Your region? No,
we have Turkish Republic's Ophthalmology Society.
Yes.
And partly SOE, they can affect us to societies, which Turkish Republic's Ophthalmology Society actually supporting us over 20 years.
Right.
Yeah.
Right. Very cool. Great. I'd like to thank all of you for contributing your wisdom and your experiences and coming all the way to share with us in APAO. Thank you so much.
Thank you.
So I'd now like to invite our own Asia Pac YO leaders. I think you know who you are. Please come on. And I think, the reason why we've chosen these individuals, other than the fact that I don't really like them, no, I'm kidding, is because they're relatively younger YO societies. As I mentioned before, for those of you who just joined the room, when we first started APAO YO, we only had 2 or 3 societies, and now we have more than 20. And some of us in the Asia Pacific region have struggled to either formalize, form, gain support. And I think each of them, because I've been involved for so long, I know their personal stories, but I'll let them share what are the issues and also what we can do in the future. So first, again, please introduce yourself briefly, and then what stage of career you're at, if you like, and then your YO experience so far. So ladies first, or only lady first?
No, lady first. Ladies first. Introduce.
Hi everyone. So my name is Ijil Murung, and you can call me Ijil. I'm a chairwoman of Mongolian Young Ophthalmology Society, and I'm a vitreoretinal surgeon and also practice uveitis. And also I work for Orbis as a project manager. Yeah, and that's all.
When was Mongolian YO formed?
How way?
When?
Ah,
When
when?
was the Mongolian
Ah.
YO formed?
So, Mongolian YO was first established in 2017 as a YO club, but we established in 2024 our own society. Yeah.
Right. Congratulations. How many members do you have?
So now we have 71 members.
That's a lot.
Yeah.
Fantastic. Congrats.
Yeah.
Okay, next. Who's next?
Maybe. Like, okay.
Go ahead. Okay. Go ahead.
Gentlemen.
Hi everyone, I'm Hiroshi Tanaka from Japan. I'm now the attending of the retinal visual surgeons, and I'm the one of the members of the Japanese YO. Japanese YO was launched in 2022. Yeah, that's all. Thank you.
How many members do you have now?
We have the 10 members, and then this year we will increase the number of to the 15 now.
And are you associated with the JOS or a particular, some people call it the adult society? Are you associated with JOS or any?
No.
Yeah. So you're completely independent? Independent? You're completely on your own, 10 members?
JOS and, yeah.
Independent.
No. It's some correlation. Correlation, some correlation with the JOS.
Okay, cool.
Right. So I'm Tai Chi Lin from Taiwan. I'm the former chair of the Taiwan Young Ophthalmologists Committee and also the Inguno chair. So with the help of our society, our committee has been established 5 years ago with the help with SK and Marcus. You witness every effort I've been through. So my job mainly was to settle the conflict between the seniors and the YOs. So now, now
is it settled?
It was settled with the help of you guys. So I think now we're on the same page right now. We're working forward together with the APAO YO committee, and then I'm getting a little bit old for communicate with the young generation.
Me too.
So I have Ray here. Ray is so we are holding the GYO meeting also with the help with Marcus in June. So everybody is welcome, and Ray is here for more information, and he's in charge for whatever is fun for the YOs. So Ray, please.
Yeah. Okay. So hello everyone. So my name is Ray Lin. I'm from Taiwan. So I'm a neuro-ophthalmologist and a pediatric ophthalmologist. And yeah, just like Tai Chi say, so YO group is getting stronger, and so I look myself as a fun part. Okay. Yeah. So this year on June 13th, so we will hold a global YO summit. So please come, and yeah, Taipei is fun, so you can. Oh yeah, we will send you guys a flyer later on. Yeah. Okay. So thank you.
Thank you. Thanks very much. And as I mentioned before at the start of the session, we created or we hold this YO Symposium session. We want to create a safe space. Your presentations and we don't want to have that kind of environment like the scientific side. So I'm also going to be very candid here. And I've asked this panel to come because I wanted you guys to share the challenges and difficulties of setting up your YO. Some of us outside in the main audience here, whether it's Philippines, Singapore, we were very lucky to get a lot of support from our parent societies to set up. And sometimes it's not even about money, all right? And we're in a region, Asia Pacific, where hierarchy and authority is very important, right? So I think we should speak about it openly, and as Tai Chi mentioned, I think what keeps us going is that the ones who are no longer young, like Tai Chi, myself, SK, you're still young, continue to support the efforts of the YO. So we're the members of the APAO YO or any YO organization actually should not be just made up of YOs. It should be anyone who's here to support YO, the future of ophthalmology, education, mentorship, leadership development. And I think we should change the way we share. When people ask you, what's APAO YO? What does your YO society do? It should not be a group of YOs. It should be an organization or a society or collection of people who believe in the investment of the future of ophthalmology. I think we should change that. And I think that that's in line with the barriers and the challenges. So I hope you can be candid and share with us. Like maybe we'll put Ijo in the spot. She mentioned, as you heard, she mentioned that they were first a club, right?
Yeah.
And then it's now a formal society. So what is that change? How did that happen? How difficult was that?
Yeah, when we were like acting as a club, it was like, of course, everyone welcomed us because we were like under our Mongolian Ophthalmology Society. So, but when we wanted to like become a more independent society, even like getting a name, Mongolian Young Ophthalmologist Society, actually our main society didn't allow us to take that name. Yeah, so we added YO later. Like our official name is like Mongolian Young Ophthalmologist YO Society. Only with that we could have our name. Yeah, but like beside of that, like probably our Mongolian senior doctors are like very supportive of us. Yeah,
That's
they're
good.
very open.
That's
yeah,
good.
So
And
everything.
the same issue which the global YOs brought up is going to be the same issue that all of us face, is money. So who gives you the money?
Oh yeah, we like always like approach the sponsors, and we very eager for that and like hunting for sponsors.
Yes.
Yeah.
And as he mentioned before, actually the industry want to sponsor YO events because you guys are the future, right? To teach me to use a new phaco machine is extremely difficult, right? I'm not going to change my mind. But to teach you guys to do new techniques, right, it's a lot easier. And I'll come back to this point in a while and why we need to come together on this. Maybe Japan.
In Japan, the Japanese society, ophthalmology society, support us, and but many companies were interested in the Japanese YO. So because of the Japanese system is very unique. It is Japan. We have the development system instead of the fellow system. The young ophthalmologists that can learn the progress surgery in a relatively early stage. So they are satisfied of that, and they cannot do the more research and in advance. So the Japanese Society of Ophthalmology is ask our YOs to accelerate the research in the worldwide. So we will now trying the more. Yeah.
So if you don't mind me sharing, actually the Japanese YOs have tried over the years. In fact, even in the 2016, 2017, we engaged JOS to encourage them. You guys are a large group community to have your own YO, but it's been very difficult. So now you have 10 members. How are you going to increase your membership?
We are now doing the domestic exchange program. To encourage the young ophthalmologists. So some young doctors submit our system exchange program, and then we can select the next YOs. And we would like to increase the number of the YO.
Fantastic. Yeah, sure. Please come here.
Thanks for this discussion. So in the Philippines, I founded the Philippine Network of Young Ophthalmologists. So, well, first of all, we'd like to thank Dr. Fang and, of course, Dr. Ang. I think they're the really moving spirits of APAO YO. So, and of course, Dr. Jubes Aquino. In the Philippines, the struggle is real. I think everywhere. The struggle is real. There will always be generation gap. Many times I have been accused of even dividing the society, that YOs are polarizing and all that. So I think for all of us, we have to accept the fact that YOs are here to stay, and that YOs is really here. The concept of having YO society is really here not to divide anything, but it's really just to uplift, to boost the morale of the young ones in preparation for the future, right? So one thing that I think is very important is to keep the elders involved, because we can't do it alone. We can't do it alone. We really have to make them realize, involve them, because that's what they want. They really want to be involved. It's not like we don't beat them. We make them join us. That's what I think. That's the overall take home of this. And then one more thing is that for us, I think we have to change our mindset also, and then we really just have to focus on the goal. Mute out the noise, but at the same time learn from them, because there's always a struggle. And there's always a struggle, but we just have to focus on the goal, because it's going to be worth it in the end. Thank you.
Thank you so much for sharing. I think as you saw from a presentation, there are 3 pillars of YO or any YO society, in my opinion. One is, of course, education and training, right? 2 is networking among ourselves, but also personal development. I don't like the word leadership development, because I think at some point, not all of us are going to be leaders, and not all of us want to be leaders. But I think our YO networks gives us personal development, whether it's within the career or outside of the career. But the last pillar you saw is mentorship. And mentorship is very important for personal reasons, but also for what reasons that Chai has shared, which is basically engaging the senior people. And they want to be here. They want to be involved, and they represent, and soon you will be in that position. You will become the mentors. So I think this sustainable program, the sustainability of this program really relies heavily on mentorship. And we are, SK and I and Jupes are working very hard to do that for the years to come. But we are a relatively young community, so as in young. We just started. so a lot of the believers have to become senior enough to support this mentorship, but we'll get there. Yeah. Sorry, yes, please.
Hi everybody, I am Karan Bhatia. I am the Vice President of YOSI, that is Young Ophthalmologists Society of India. Yes, this is the symbol, YOSI, yes.
How many members do you have?
So we have 5,000 members.
Oh.
Okay, so...
Never mind, Japan will get there,
So I echo what everybody, Marcus,
it's about population.
Everybody was saying that you need your seniors here. Getting the initial funds is very difficult. That's just the initial first step. So if you talk in terms of rupees, getting 100,000 for a conference, that's about 1 lakh, right? So was a big task. So AIOS, that is our parent body, we are an independent society, but the AIOS has always, All India Ophthalmological Society, the leadership has always helped us. Now once that is done, now you multiply that by 10 or 100, we can get it. Because in the initial days, we showed the companies as sponsors what we are and what we can do. So now they are willing to, in fact, negotiations are currently on every day at this meeting as well. So keep on working hard, I would say, and you are the potential, you are the future, but at the same time respect your seniors and elders. That's very important.
Thank you. We're running out of time, but I wanted to give some airtime to Tai Chi as well. Maybe you can share, if you're willing, candidly about some of the issues that you alluded to earlier, without going into details, of course.
Yeah, I think I briefly mentioned a little bit, but I think it's about some kind of compromise, So the Taiwan YO committee is also under the supervise of the Taiwan Ophthalmologists Society. So otherwise, I think it's all about moving forward and providing a platform for the young generation. So we're not dividing anything. We're not fighting for resources. So and then we have 12 members in the very beginning, and then now these 12 members have actually become very important positions in their own institute. So that's how we raise. Now we don't have to fight for resources, and resources comes to us.
Right.
So I think this may not. You may not replicate our experience, but I think it's pretty similar all around the world.
Yeah. And so the final word will go to Ray. I think Ray, as Tai Chi mentioned, is now going to take over the Taiwan YO Society. So what are your plans? I mean, we talked briefly about the global YO. So just to share briefly about global YO, I mean, again, we're not trying to create another society or another group of people. What we really want to do is everything that we spoke about here, and give you a concrete example, such as funding. You know, what we really realize is that, for example, within APAO, if we raise funding here centrally, right, we can then distribute it out. So for example, for me in Singapore to raise sponsorship is extremely easy, but I don't need the money. So what we do is that, how we started was that we raised a lot of sponsorship money from industry in Singapore, and I started distributing it out to Asia Pacific, centrally. And that, I think that taught us that essentially what we need is a united central body for YO, so that we can centrally raise and distribute the money. Because if you go to, I'll give you ASEAN, for example, in Southeast Asia. If I go to Brunei, and I go, there are 4 ophthalmologists, 1 cataract machine, and I say, I want to raise sponsorship here in Brunei. There's no way. There's no absolute way. So all this money that we're talking about, if there's no parent society to support you and there's no industry support, then you can't start. So it's a non-starter. So I hope that you guys will support GYO, which Ray is leading. We want to do things like funding. We want to raise awareness. We want to share, how you set up your society, frameworks, toolkits. We'll share some of these things at the global level. Ray, do you want to?
Yeah, just
last word.
Okay, so thank you, Marcus. So for me in the future, so like this time GYO, so thanks to Marcus like raising some funding, and also in our parents society, we also raising our own funding. So I think this like a collaboration will be like a very bright new future for all our YO community. So we can like have a very good collaboration, and we will have different funding from different sources, and that will make our society and young ophthalmology have a very bright future. So that's the bottom line. And also, I just want to hope everyone just do it. The parents, the parents society, they are actually supportive, but you have to have the good negotiation. So one of our parent society boss is over here. So you listen to me. So that's why I'm telling to him, all right, please support me. Okay, just kidding. But we just want to say that you have good negotiation, good communication, and just let them know what we are going to do. Not really have to, we are not going to divide it. So like Che saying that, it's very, very important. Yeah, that's all. Thank you.
Thank you very much. Thank you so much. Thanks to the panelists. And now the time that all we're waiting for is the awards presentation. As you can see, we are redistributing the wealth. So I hope you guys appreciate the awards. So first off, the travel grants. So Jupes, can you announce the travel grant winner? So we have a group photo, okay? So all the travel grant winners, please come forward to receive your prize, and then we'll take one group photo, all at one go.
So please come to the front of the stage, Dr. Florentina Priscilla from Indonesia.
Just announce all of them.
Okay, next we have Dr. Shufei Chi from Malaysia. Come forward, we would like to acknowledge Dr. Diksha Bista from Nepal. And last but not the least, we would like to call on Lawrence Jacob Mangahas from the Philippines.
Yay.
Congratulations
Congratulations,
all
guys. Well
for
done.
the YO travel grants.
So after this, I think the rising stars, we would like to again just invite all the rising stars to come up and just take one group photo. You will have your cert later, or you can hold it without opening it, and then you can swap it later. So just for info, the Rising Stars Award is really to groom the next generation of YO leaders. We have representatives from each country or each YO society, and I hope all of you have formed a strong network among yourselves, and we'll call upon you next year to be involved in our mentorship program. All right, so in no Thank you. Thanks very much. So in no particular order, Dr. Wendy C., Dr. Karan Bhatia, Dr. Angel Matthews, please come up. Dr. Tran Trong Kan, Iqbal Ao Chilik, Jose Antonio Paulino, Trong Nan, sorry if I got your name wrong, Trong Nguyen, Muhammad Azam, and Lilia Amaral Bogus. Thank you for participating. You guys have done so amazing work. I mean, I spent time with you guys, and I hope that you guys will represent your societies in the years to come in the YO activities. After the last presentation, please don't go. We will do a group Wi-Fi. It's epic. It's usually very difficult to do, so we'll need a volunteer with very long arms to stand in front. So we'll do the group Wi-Fi that direction. So you guys just sit, and then we'll all turn around, okay? Yes, don't worry, don't worry. Yeah, don't worry. You'll come. Yeah. We still have a lot of awards to give out. We have the Surgical Video Award.
Yes.
Next. So, Jupes, you want to... Yeah, sure.
So for this year, what we did was review the posts for the past year, and for those who posted surgical videos, we looked at the reach and the number of likes. So this is an incentive for those who are active in the Facebook group. So we hope that we can encourage everyone to keep posting and keep updating the other YOs in the Facebook group. So the winner is the best surgical video with the most number of likes and reach is Dr. Ashraful with the marking of toric IOL.
Congrats. And last but not least, the Best Presentation Award. Thank you so much for the three of you for doing such great jobs. Yes?
Yeah, I just like to encourage all of you to enter this Surgical Video Award. I mean, I think we will do more announcement. You are encouraged to post your videos in the Facebook. And then for this Best Presentation Award, it's actually from the submitted entries to the APAO, every APAO. So we actually select those that are submitted by YOs, and then after that we shortlist. And so this year, unfortunately, we have selected 6, but 3 of them could not make it because of the visa issues. So again, I would like to congratulate all of you for submitting papers and videos for the YO Awards.
Okay, so now we go to the Best Presentation Awards, and we would like to first call on the third place winner. Goes to Dr. Shireen Sonvane with a presentation on implantable collamer lens for short sight and not so long eyes from India.
Congratulations. Well done.
So for the second place, we would like to call on Dr. Wan Raja Wan Nawang from Malaysia with the impact of mobile cataract program on the improvement of effective cataract surgical coverage, insights from national eye surveys in Malaysia. And of course, the first place goes to Dr. Ikwanuliman Putera from Indonesia with a presentation diagnostic biomarkers for uveitis, combined serum BAF, CXCL9, discriminate ocular sarcoidosis, tuberculosis, and other uveitis and entities. So congratulations to everyone.
Great job, everyone. Okay, YO9. The most important, second most important event after this symposium. Second most important.
The YO influence.
Can we have that? Let's take the picture first. Yeah. Let them take the picture. So, so again from the Vayo body of India, that is Young Ophthalmologists Society of India. I am Karan Bhatia, the Vice President, and Dr. Prasanna Venkatesh Ramesh, who is the Joint Secretary. We invite you to the APAO Vayo Night. This is going to be tomorrow, 6:30 p.m. onwards. Okay, all of you are invited. If you want your friends also, just give us a buzz. We have Indian hospitality. Everything is possible. We have booze, we have snacks, we have some Bollywood numbers to dance to, and we're going to have a blast. And if still you are not done, we can do an after party till 5 a.m.
What does dress to impress? Must dress like this, is it? Dress to impress.
Regarding the dress code, you'll be seeing us in all attires tomorrow.
Okay.
Be it light dresses, where you'll have battery assisted dresses where you are going to get illuminated.
Sure.
Some of my APO LDP friends are here and they saw just a few trailer of yesterday, and the dress codes are going to be so awesome.
Yep.
And Indian hospitality, as Karan Bhatia has just mentioned, we have left no stone unturned, as he rightly told. If any of your friends are there, you want us to send a personal RSVP from the official account, we are there here. We are going to share the contact details of all the UC Governing Council members, sir. And it's going to be one hell of a night to remember. And we are looking forward to having you all. Thank you.
Sounds good. Thank you so much.
And Chair will be sharing our numbers, personal numbers. If you have a problem in anywhere in India, it's not just with APO event, AIOS event. You're going shopping, you need help, you need to go to a bar at this time. I need not that. Okay.
It's like the better call Saul.
So give us a call.
Don't call the
somebody will
number.
help
They're
you
giving you burner phones. Don't call it. No, thank you so much, guys. Thank you. Okay, last very important is the photo. I recommend that we take it this way. So all of you who are seated, just remain seated, and we'll come to you. Can we get somebody to stand? Oh, sorry. Last but not. Oh yeah. Okay, I'll do it. So basically, we also have a last award. The only non-scientific award that we have, which is influencer, is very easy. All you have to do is take a photo, upload it to Instagram, tag APOYO, and if you get the most likes, you win. How much do you win? $300, my God. Okay, $300 for being popular. Oh my goodness, I think we should lower it.
Sorry, that was a mistake.
Oh, right. We're getting compliant. We're getting non-compliance complaints. Yes, $300. Sorry. But just to get a few likes. So please post as much as you can. It can be anything during the conference. It can be something personal. You can be your costumes. But tag it, and we'll give it out at the end of the YO night. Only at the end. The survival has to come. Okay. Okay, please remain seated while we... Photographer, can you... do you think you can squeeze all of us in?
There is a special prize at Bio Night for who dresses the most elaborate. Prasanna is not eligible for it.
I didn't know that. So, as you guys are getting ready for the photograph, so we have an announcement from UC Vayo Night where the most well dressed or the most eccentric dressed person also has an award. Get ready for the same. Yeah. So dress to impress.